So our today's topic is axilla. What is axilla? Axilla is the area, in layman terms, it is the armpit. It is the area that extends from the clavicle below till the upper part of humerus and medially till the upper four ribs. So it is a pyramidal space that is bounded by an anterior wall, a posterior wall, a lateral wall, a medial wall, an apex, and a base. In this picture, we can clearly make out that this area is the apex of axilla. This area is the base of the axilla or floor. This posterior wall is lying posteriorly. This is the anterior wall in the front. This is the lateral wall, and this one is the medial wall. The main content of axilla is the axillary artery. Now, first of all, we'll discuss the apex of axilla. The apex of axilla is also called the cervico-axillary canal. It is bounded medially by the outer border of first rib, posteriorly by the superior border of scapula and the medial part of coracoid process, and anteriorly by the posterior border of clavicle. So this triangle is the apex of axilla, and it is bounded medially by the rib, first rib, anteriorly by the clavicle, and posteriorly by the scapula. So this triangular area forms the apex of axilla, and this is also called the cervico-axillary canal. Now the base or floor of axilla is lying inferiorly. It is composed of skin, superficial fascia, and the deep fascia, which is also the axillary fascia in this area. So from outwards to inwards, the layers that we encounter in the floor or base of axilla are the skin, superficial fascia, and the deep fascia or the axillary fascia. Now the lateral wall of the axilla is formed in this area where the humerus lies. So this is the lateral wall of axilla, which is the area of the intertubercular groove of the humerus and the muscles attached, which are the coracobrachialis and the short head of biceps brachii. The medial wall of axilla is formed by the first four ribs, their intercostal muscles, and upper part of serratus anterior muscle. As we know that serratus anterior muscle is attached to first 8 ribs via 8 digitations. The first 4 ribs along with the intercostal muscles and the serratus anterior muscle attached here forms the medial wall of axilla. The anterior wall, you can imagine well that the anterior wall in this picture, this is a cross section, we can see the anterior wall of axilla. This one is the anterior wall. It is formed by the pectoralis major muscle, the outermost one. Then is the clavipectoral fascia in between, and below that is the pectoralis minor muscle. So the anterior wall is formed by pect major in clavipectoral fascia and the pect minor muscle. And the posterior wall is formed by the muscles that are attached to the scapula. We'll discuss scapula in another lecture. The muscles which are forming the posterior wall are the subscapularis muscle, the latissimus dorsi muscle, and the teres major muscle. These three muscles are making the posterior wall of axilla. In this picture, we'll summarize all these walls of axilla. This small one is the apex, which is also called the cervico-axillary canal, formed medially by the first rib, posteriorly by the scapula, and anteriorly by the clavicle. This orange one is the floor, which is formed by skin, superficial fascia, and the axillary fascia. This purple one is the medial wall. The medial wall is formed by first four ribs, their intercostal muscles, and the serratus anterior muscle, the upper part of serratus anterior muscle. The lateral wall is formed by the intertubercular groove of humerus, coracobrachialis, and the short head of biceps brachii. The anterior wall, this red boundary marks the anterior wall. It has the pectoralis major muscle, pectoralis minor muscle and the clavipectoral fascia intervening between them. And this yellowish posterior wall is formed by the subscapularis muscle, the teres minor muscle, and the latissimus dorsi. In this picture, this is a cross section again. This is humerus, this is intertubercular groove. These are forming the lateral wall. This is the anterior wall having the pect major, pect minor, and the clavipectoral fascia in between. This is the medial wall having the first four ribs, serratus anterior, and intercostal muscles. This one is the posterior wall having subscapularis, the teres major muscle, and the latissimus dorsi muscle. Apex is formed by the cervicoaxillary, also called the cervicoaxillary canal, is formed by the rib, scapula, and clavicle. And the base is formed by the skin superficial fascia and the deep fascia. Now, I have repeated it multiple times. I hope that you know all of the boundaries of the axilla by now. Now we'll briefly discuss the contents of axilla. Contents mainly are the axillary artery and its branches, the axillary vein and its tributaries, the infraclavicular part of brachial plexus, 5 groups of axillary lymph nodes, long thoracic nerve and the intercostobrachial nerve, axillary fat and the alveolar tissue. These are all the contents of axilla. We'll discuss them one by one. In this picture, this is a cross section again showing the anterior wall, the posterior wall, lateral wall, medial wall. We can see all the contents here. This one is the axillary artery along with the axillary vein. These are branches of the infraclavicular part of the yellowish are the infraclavicular part of brachial plexus. These green ones are the axillary lymph nodes. And what else we can see here? That's all about it. In this picture, we can then again see the contents of axilla. This is the area of axilla. This is the axillary artery, the axillary vein, the infraclavicular part of yellowish one is the infraclavicular part of brachial plexus. This one is the long thoracic nerve, which is also one of the contents, and a small amount of fat. Now we'll discuss axillary artery, one of the main contents of axilla. This reddish structure is the axillary artery. It is a continuation of subclavian artery. At the level of outer border of first rib, the subclavian artery is named axillary artery in this area till the lower border of teres major muscle, from where it onwards it becomes the brachial artery. So the subclavian artery till outer border of first rib becomes axillary artery till lower border of teres major and becomes brachial artery. So we are going to discuss this part of axillary artery between the outer border of first rib and lower part of teres major muscle. This is axillary artery, which is subdivided into 3 parts. The first part, second part, and the third part. So what is the structure that divides axillary artery into 3 parts? This pectoralis minor muscle. The pectoralis minor muscle is the demarcating point for the 3 parts of axillary artery. Axillary artery is a continuous artery. How we can say that it is divided into 3 parts. The first part of axillary artery is superior to the pectoralis minor muscle. The second part is behind the pectoralis minor muscle, and third part is inferior to the pectoralis minor muscle. So we'll discuss axillary artery into these 3 parts. Again, in this picture, we can see subclavian becoming axillary. This pectoralis minor muscle is dividing it into first part, second part, and third part, and these are multiple branches of the axillary artery. So in this picture, we can see this is the first part of axillary artery where 1 is written. This is the first part of axillary artery. The first part of axillary artery gives off 1 branch. The second part of the axillary artery gives off 2 branches, and third part gives off 3 branches. So it is very easy to remember that first part has 1 branch, second part has 2 branches, and third part has 3 branches. So the first part giving off the only branch is the superior thoracic artery. The superior thoracic artery passes between the pectoralis major and minor muscle and supplies them. Then the second part gives off 2 branches. One is the thoracoacromial artery and one is the lateral thoracic artery. The thoracoacromial artery further has four parts I'll discuss in the next slide. And the lateral thoracic artery is the one that is supplying the breast. The third part gives off three branches. The first is the subscapular artery. The second is the anterior circumflex humeral artery. And the third is the posterior circumflex humeral artery. So now we know that the first part has one branch, this one. The second part has two branches, which are underlined by the red color. And the third part has three branches, which are underlined by the green color. In this picture, we can very clearly see that this pectoralis minor muscle is dividing axillary artery into three parts. The first part is lying superior to it and giving off a single branch, the superior thoracic artery, which is supplying the pectoralis major and minor muscles. The second part gives off two branches. One is the thoracoacromial branch and one is the lateral thoracic branch. The thoracoacromial branch is further subdivided into four parts. One is the clavicular part, which supplies the acromioclavicular joint. The next is the pectoral branch, which supplies the pectoralis muscles. Third branch is the deltoid branch, which passes into the deltopectoral groove along with the cephalic vein. And fourth one is the acromial branch, which takes part in the anastomosis around the acromion process. So thoracoacromial branch of the second part of axillary artery is further subdivided into four parts: the acromial part, deltoid part, clavicular part, and the pectoral part. The second branch coming off from the second part of axillary artery is the lateral thoracic artery, and it is passing along the lower border of pectoralis minor muscle, as you can see here, and it supplies the breast tissue in the males and females both. This third part of axillary artery gives off three branches. Number one is the largest branch of axillary artery. It is called the subscapular artery. This one also gives another branch that is called the circumflex scapular artery, and it continues off as the thoracodorsal artery. The other two branches that it gives off are the circumflex scapular arteries, the anterior one and the posterior one. So the anterior circumflex scapular artery, the posterior circumflex scapular artery, and the subscapular artery. These are the three branches of the third part of the axillary artery. So if you just remember this slide, which is enumerating the first segment giving off one branch, second segment giving off two branches, and third segment giving off three branches, you will remember very clearly and precisely what is axillary artery and its branches. Now in this picture, I'll briefly discuss the first part of axillary artery giving off superior thoracic, supplying the pectoral muscles. The second branch giving off the two branches. First is the thoracoacromial artery, giving off the clavicular branch, the acromial branch, the deltoid branch, and the pectoral branch, the four branches of the thoracoacromial artery. And the second branch from the second part of axillary artery is the lateral thoracic artery, supplying the breast tissue. Third part of axillary artery is the subscapular artery, giving off the subscapular artery and the circumflex scapular arteries, the anterior circumflex scapular and the posterior circumflex scapular. In this picture, we can see these are the anterior and posterior circumflex scapular arteries, which are forming an anastomosis around the level of surgical neck of humerus. That's all about the axillary artery. Now I'll briefly discuss the axillary vein. Axillary vein, as I've told you earlier a lot of times, that the veins follow arteries. So axillary vein is lying along the axillary vein is lying along the axillary artery. It is formed by the union of the brachial vein and the cephalic vein. These two veins join to form the axillary vein, which goes up and is drained into the subclavian vein. That's all about today. Thank you.